Something that has been called a last resort could well be the federal government's next move. Sources tell CBC News Ottawa is closer to triggering the Emergencies Act. That is a law never invoked before in this country that would give the Prime Minister and his cabinet special sweeping powers. Vashi Kapelas hosts Power and Politics here on CBC News Network, and she's also been a vital part of our special broadcast every day around the Prime Minister's briefing. Great to see you this morning on our program, Vashi, and thank you for the time.
My pleasure. Nice to see you too, Heather.
So CBC News reporting and has learned, Vashi, that there have been consultations going on with the premiers and territorial leaders about the Emergencies Act. We have talked about how the Prime Minister, the federal government, has been reluctant to invoke that because they've said that existing legislation, like the Quarantine Act, that has been sufficient. What has changed? Why now?
Well, look, I would say that since the beginning of this outbreak, let's say roll back about a month, the Prime Minister has talked about the possibility of using it, the Health Minister as well, other ministers too, but often, as you rightly say, Heather, described it as very much so a last resort. What has shifted is that they are in preparation for the possibility of using it. And by that I mean, and I should credit here our colleagues, Catherine Cullen and David Cochran have done a lot of digging into this, but they have essentially, there's a process that they have to start in order to be able to invoke it. They have to send letters to the provinces. They have to consult with the provinces. It has been a subject of conversation in many of the calls, including briefly last night, between all the premiers and the Prime Minister. And so they sent this letter out to the provinces to sort of ready them and get their feedback on it. By and large, and this is, public conversation as well, we've interviewed all the premiers, most of them don't see a need for the invocation of the Emergencies Act at this point. There are some smaller provinces. I would highlight, for example, New Brunswick, the premier there, Blaine Higgs, who in the past has called for it to be invoked. Also, the head of the nurses union, she's asking for it to be invoked. And I'll tell you the primary reason why, Heather. It's all about supply. We've talked about it for days now. The possibility that the supply might run dry of PPE, and they are hoping that the federal government takes sort of a leadership role in trying to figure out how to adequately disperse it among provinces, or if there's a hot spot, to be able to direct it there. At this point, though, provinces by and large are saying, we're not there yet, you don't need it.
And what is the chief objection? I mean, we've heard from Saskatchewan, for example, notably, it has been throughout this discussion, Vashi, that this would be a bit of an overreach. It's not necessary, and perhaps what they're doing on the ground provincially is actually the best response. Is that the same sort of argument against it at this point?
Yeah, I think, look, provincial jurisdiction is a big deal for the provinces, certainly, and healthcare is one of the chief items that they have jurisdiction over. There was a feeling among most premiers that they know what their province needs best, and they are able to adequately address the issues that perhaps the Emergencies Act would substitute in for. And so I think that, again, by and large, they just don't want the federal overreach there at this point. But the federal government might have to come at it from a different perspective. If there are certain hotspots that are lacking in PPE and they aren't able to use this current system to address that, then that's where the Emergencies Act would come in. But like you said, and like I said, they have continually described it as a measure of last resort.
Something that has just gone up online, Vashi, CBCNews.ca, another of our colleagues, John Paul Tasker, has been looking through some government documents, some briefing notes specifically, looking at Canada's response to COVID-19, the evolving response, and the conclusion was it was a slow start. Can you tell us about this new reporting we're just starting to hear about today?
So this is really fascinating. These are a number of documents that were tabled to the Federal Health Committee. The Health Committee and the Finance Committee are two committees that are still meeting during all this virtually. And these are all the briefing notes that the government, and particularly the Minister of Health, was provided with in the sort of lead up to what we have been talking about for the past month. And what really, there's so much in there. JP has done such a great job of really getting into the details and trying to get a sense of what was happening behind the scenes as we saw it start to ramp up in China, but hadn't really come here yet. And the main takeaway I took from it was basically around the conception that bureaucrats had and the advice that was being given to the health minister about how bad the virus was, how much it might spread. And what they were saying, and I'm paraphrasing here, was they didn't even think it was human to human transmission at the time, right? That was the advice being provided to the health minister. And when it came to travelers coming from Hubei province and Wuhan, they thought, well, they were giving the advice, well, it's going to be too much pressure on our healthcare system, and we don't really have the ability without the Quarantine Act to quarantine everybody and to impose those travel restrictions on them. And so as a result, I think JP highlighted from January 22nd to February 18th, 58,000 travelers arrived in Canada from China. More than 2,000 of them were coming from Hubei province. At that time, you'll remember that was sort of the epicenter of the outbreak. What you also see from these documents is as soon as it left China and hit Iran and Italy, and we did see that human-to-human transmission, we saw more community transmission, the advice definitely shifted. And if you think back to that time, as I was reading through this, you could really see a shift in the government's response as well. We went from talking about repatriating Canadians from Wuhan to what is the risk here in Canada, and the rest, as they say, is history.
Is history. So despite the fact that they are still in the midst of it, it's bearing reflection on decisions made, potentially mistakes made, lessons to be derived from it, because there's still many decisions obviously to come. Clearly from the Prime Minister, months ahead in this ongoing fight against COVID-19. Vashi, thank you very much.